Now, for moving forward, you have to identify the possible risk factors for what are the certain conditions present in each person that predisposed you to having the diabetes in the first place. Some of these risk factors may be taking alcohol ingestion, sedentary lifestyle, taking of refined sugar. You have to identify all of these possible risk factors and take it out. For patients who have they're just seated all through the day, not even trying to get any form of exercise, you have to encourage such patients. You need to try and move around more. Because of innovations in health now, we have these wristwatches that monitors your step count, which I think is very nice. The more steps you take, the more you burn calories, which is helpful in the management of diabetes. Now, once you identify the risk factors for the patient, you take it out. And for patients who drink, who smoke, you have to tell them to cut down on such habits, because it's going to help them in the management of diabetes later, so they are not drug or insulin dependent for a very long time. They are still going to be drug independent, but you tend to reduce the dose eventually. I'll still get to the eventual treatment. Now, you have to, encourage the patient. It's not easy. Diabetes, like I said, is a chronic illness. That means it's there to stay. You can get it under very good control, but not that you have total cure. There is no cure for diabetes. You just manage it properly. So you have to let the patient know. Another way to manage is to be checking your blood glucose levels. They are simple handheld devices that easy to use. You don't have to necessarily come into the hospital to check your blood sugar. You can get the device and check your sugar. At most, you forward your results to your doctor for review and you move on from there. Now, for the proper treatment of diabetes, there are two ways. Either you use the insulin or you use the oral hypoglycemic agents. That's drugs that lower the blood sugar. Now, they are different depending on what type of treatment you use. Depends on how you present. Your first presentation depends on how you present to the doctor the first time. Now, remember I said certain patients come in coma because their blood sugar is so high, their body has tried to make necessary adjustment, but it's just decompensating. So such patient passes out. The only way to control blood sugar in that case is insulin. Such patient may have to be on insulin for a very long while before you achieve good control, and then you can then convert or combine with the oral drugs. Very few patients now are on oral anti-diabetic drugs to control their blood sugar. This set of people who use, I'll start with the oral drugs. The people who are only on oral drugs, those who fall under that category are those who to an extent have adhered to the doctor's instruction, like removing the risk factor. If you're smoking, stop it. If you're drinking alcohol, stop. If you're living a sedentary lifestyle, try and do more of aerobic exercises. There are different forms of exercises. Weightlifting will not burn your sugar. It's not an aerobic exercise. You have to do weightlifting is an anaerobic exercise. That means you don't consume a lot of oxygen. So whatever the sort of exercise you do should consume and burn energy for you. So you need to do more of aerobic